over there, and thank you very much indeed for coming along. Today's about really accountability, and the Cabinet Secretary, as you know, last year we had the Public Minister, Minister of Public Health, who was here. This year, you've got me, and that happened 2 years ago as well. But my role here is to, on behalf of the Cabinet Secretary, try to ensure that the board, NHS Orkney, is accountable to the people of Orkney, to the service users, to the staff, and to all those that are associated with NHS Orkney. That's so important to us, and I think we've been getting better in NHS Orkney about being open and accountable, and this is really part and parcel of that. But I am also held to account today, so I want you to be the ones who hold us to account. This is about the public asking questions of NHS Orkney, and hopefully getting the right answers. If we can't answer them today, we'll be answering them in future to you. And also to encourage you along the way to become more active, to become more a part of what we do here. We're very much trying to get more into the partnership mode in NHS Orkney, and we really think that you, from all groups, are part and parcel of that journey that we're on. So, question and answer sessions we have at the end of every single board meeting. So anyone who hasn't been to a board meeting would like to come along, please come along and ask any pertinent question you have. And you'll get your chance today as well to do likewise. I've got a notification that today we have visitors with us, observers, in Yvonne Summers, our performance manager, who's been at all of the sessions since I've been chair, I think, yeah. And also we've got Christine McFarlane-Slack on scheduled care of the Scottish Government, who also used to work here with us at NHS Orkney. So welcome back to you, Christine. I hope this is going to be a meaningful exchange. What we are going to do is we're going to call on Cathy to give us a 10-minute directional speech as to how things have gone over the year 2013-14. And then really it'll be up to yourselves to ask any questions that you like of us as a board. So without any further ado, Cathy, I'll just pass over to you to give us the feedback and the details of the year past.
That's a good start. Oh my goodness, that's loud. Thank you very much, John, and good afternoon, colleagues and visitors, to this very important event, our annual review. This is a review of 2013 performance, so I will be reflecting on the year previous as opposed to this year going forward. Is it okay if I sit? Is that okay?
The only thing is it won't be on the webcam as I see it. Or can you see it? Is Cathy going to be visible? Oh yeah. That's
I've missed a trick then. No, okay. As John says, this is a non-ministerial annual review, and it's led by the chairperson of the NHS board, and in this case NHS Orkney, who acts as, so John is acting as the Minister's representative, supported by our Scottish Government officials, who are also here to witness and to hear directly from us within the board and from Orkney on matters that are important to you and to us. And those matters those issues are things like being cared for with compassion by staff who see us as people with families and a life that is beyond our condition. Being cared for in facilities that are clean and safe, and being cared for by a board that sets out an ambitious programme of investment that takes account of improving population health, improving health services, whilst at the same time making sure the investments and changes we make on your behalf are indeed affordable and sustainable as we strive to deliver person-centred, safe and effective care and services with our staff now and well into the future. Chair, I think the strategy that we've adopted, informed by our staff and indeed by our partners and the people of Orkney, to invest in more services in communities and in Orkney is being delivered. I think it's a strategy that quite rightly is ambitious, an ambitious programme of change, a programme that's about transformation and investing in new ways of working that includes very much bringing services back here to Orkney in ways that secure and embed long-term change as we look to deliver sustainable services well into the future. Chair, over the next 10 minutes or so, it would be my intention to respond directly to the actions set out by Mr Matheson, the Minister for Public Health, when he chaired our annual review in this room last year. Mr Matheson in his deliberations set out a number of key actions for us to deliver on as a board, and these included: Mr Matheson made it clear he wanted to see further progress on those issues outlined in this slide. Issues such as infection control and responding positively to requirements highlighted in unannounced and announced visits. And in that previous year, we've had 2 such visits. In that review, the inspection team highlighted ownership of infection control and prevention issues by all staff. They wanted to see an improved approach to our standard infection control precautions and making sure our facilities and equipment are clean and in good standard. Mr Matheson also highlighted a number of key areas: smoking cessation, cancer treatment, stroke care and dementia diagnosis and support. The Minister sought assurance and integration and our ability as a board to deliver our financial targets, including financial balance. In response, Chair, I can confirm that as a board in 2013-14, we met our 31 and 62-day cancer targets, as well as our treatment time guarantees, as well as our 18-week referral to treatment and our 4-hour accident and emergency targets. Targets that matter to each and every one of us in this room. Targets that ensure we get the care when we need it. In stroke care, I'm pleased to announce that we have improved significantly, and in June of this year, in the reporting schedule, we achieved above the 95% standard. Our achievement is the result of having designated stroke beds in the Balfour Hospital and our investment in a consultant-led model with a consultant physician leading in this key area of care. CT scanning, whilst not yet up and running, has been fast-forwarded, and this board has moved its decision from having no CT scanner in 2010 to a CT scanning service in our new hospital to a scanner fully integrated in this hospital from early 2015. And for those people, including myself, that have been disappointed by our delay, please be assured that the original mobile solution has been replaced by a top-of-the-range, fully integrated scanner here on this Balfour site. And of course, I am sorry that our programme has been delayed, but the solution, now improved, will be far superior to support the needs of our patients here in Orkney. In smoking cessation, we do struggle with this target, and having speaking to people who smoke, we have invested in a key worker, and the messages that have come back is very much about out-of-hours support and indeed support in places which are not medical settings. And we will focus very much on that, including with our local pharmacy colleagues. In the remaining 2 areas highlighted by Mr Matheson in his 2012-13 review, Chair, I will come back to these, and these are the integration and our financial position as a board. Chair, having looked back, I'm keen now to move forward and to review what we've achieved in 2013-2014. And before doing so, I thought it was really important to remind ourselves of those key objectives informed and agreed by our staff. Our corporate plan was approved by the board in April 2014, and in this plan we agreed, in 2013, and in this plan we agreed 6 corporate objectives, which in turn would inform my objectives, my director's objectives, and indeed our staff as we cascaded this performance throughout our organisation. The first focuses very much on improving the health of the people of Orkney and including our staff in that objective, whilst at the same time addressing inequalities. This objective very much focuses on prevention and partnership working with our colleagues and members of our community planning partnership, elected members from Orkney Islands Council, the police, education, housing, fire and rescue, the voluntary sector, as we work together on key issues that we can all contribute to. Issues such as alcohol, childhood obesity, and supporting people as they get older, live at home or in their communities. The second focuses very much on improving individual experience for our patients and our families. And last year we received 38 complaints from people who thought we could have done better. As a board, we're encouraged that for those 38 people, we have and can change things that continue to improve our services and the care we provide. This board puts the quality of patient care, especially patient safety, above all other aims. We continue to engage, to empower and to hear our patients and their carers, and we have brought their experience, their stories into this boardroom as we strive to embrace a culture of transparency and openness that supports our learning as we endeavour to make things the best we can. Our third objective is to develop our staff, our people, and we encourage wholeheartedly their growth and their development as we work together to improve our working environment, their working environment, our services and indeed our processes. And to date we have seen our performance in developing personal reviews and personal development plans improve from 20% to 51% and from 26% to 88% respectively. In sickness and absence, we continue to have one of the lowest rates in Scotland, and in June this year we reported an all-time low rate of 1.9%. And whilst we're pleased with progress, we know we could and we know we should do better. To help us do better, we ask our staff, and 48% of those staff who completed the national survey, the second highest response rate in all of the territorial boards, told us they feel listened to and involved in decisions. But they also told us they want to be even better informed through more face-to-face communications, and we will do that. And finally, in keeping with our staff development theme, I'm delighted to confirm that we continue to host our annual staff award scheme, and this year we will once again hold a 2-day staff conference that focuses on leadership and patient safety or delivering high quality care and services. Our fourth corporate objective is to ensure we make best use of our available resources. And whilst last year we met all 3 of our financial targets, we needed to secure brokerage from government colleagues to offset high locum doctor and nurse costs in year. Costs which continue to concern us as a board as we compete to appoint high quality staff with other NHS boards across Scotland and in the wider UK and European market. On a more positive note, I'm delighted that having set aside investment to support a strong professional structure, we now have made appointments to our lead nurse, our lead HP, our lead GP and lead midwife, all of whom will support our clinical directors as we progress and strengthen our clinical governance and patient safety programmes and ways of working. Corporate Objective 5, ladies and gentlemen, relates to performance and our ability to achieve and deliver against national and local targets or standards. Chair colleagues, I will not dwell on this objective because our performance is good. We punch well above our weight. And in achieving our targets, it gives us a message that we're doing the right thing. We're delivering for the people of Orkney. But targets within themselves are meaningless. They need to be seen as part of a whole performance regime, and for that they only provide us with some insight. That's why it's important that we hear directly from patients and their carers and the public in this regard. Can we do more? Can we do better? Of course we can. As a board with ambition, we will continue to work with our staff, with our partners and the people of Orkney to improve the health of our population and the care and services we provide in ways that are responsible, in ways that take account of affordability and indeed sustainability. I thank all my staff for the part that they play in delivering against targets and standards set. And in delivering on these targets and standards, we will continue, as outlined in corporate objective number 6, to support and to encourage and nurture a culture that promotes improvement, integration and innovation. To date, our board with our staff have supported a change agenda that will help transform how we deliver services here in Orkney. So just for a moment, looking at our outline business case, just to remind ourselves what our transformational change programme really was about. What was that aspiration? What did we want to achieve? Our outline business case set out our vision to transform services in response to demographic change, population health, and need and advances in technology and treatments and so on. Our strategy looked to address 3 questions. What can we do and what do we need to do by ourselves on this island? What do we need help with at a distance and or on this island? And what role does IT play in giving us the decision-making support that is critical to help us answer this question? So, for example, we need access to the very top doctors, not just here in Orkney, and the very top nurses and AHPs, not just here in Orkney, but beyond Orkney, so that when we have critically ill patients in our accident and emergency unit, we can tap in through an IT source to that expertise. We are, in essence, their hands, and equally we need the same doctors in our outpatient rooms consulting with our patients using telemedicine. And the third question that our strategy looked to address, and what can we not do in Ireland? And therefore our role is to resuscitate, stabilise and prepare for transfer. We have recruited exceptional consultant staff who help us with all these 3 questions in regard to hospital services. And just moving on then to 2013-14. To date, Chair, we have made it our business to bring services back to or to establish new services here in Orkney. Our investment in a consultant-led hospital model has to date recruited 5 to our 7 consultant vacancies. And in doing so, we have ensured we have sustainable maternity services, going into the future with 2 new obstetricians, gynaecologists. We can now deliver a service with our midwives that is no longer fragile and uncertain. And we can repatriate services that are already being delivered elsewhere. Gynaecology services, having invested in staff and equipment. And we will do much more when we've completed our interim build programme here in the Balfour site. A build programme that will establish temporary additional theatre stays as we look to recruit to more additional posts. In medicine, we've recruited 2 consultants and we'll begin to work with them to further establish outpatient clinics here in Orkney. We're out to advert to increase this team to 3 and we're optimistic that we will appoint to this 3rd consultant vacancy this year. In anaesthesia, we now have a full complement of staff, having appointed an additional consultant to this team. In surgery, we have not as yet been able to recruit an additional surgeon, and we will continue to work with our current consultants to cover this gap. Keeping with other staff, we've invested in and appointed 3 new members of staff to our laboratories. We've recruited to our CT radiographer posts and additional X-ray posts. We've invested in and appointed to our professional structure, and we continue to look innovatively as to how we attract and recruit staff. And we have secured very recently a partnership with the Military of Defence to support clinical placements on the islands, in the community, and indeed accident emergency. And Chair, whilst I absolutely acknowledge our locum bill was high, it would be wrong not to focus on the achievement that we have reached in that year to date. Our ability to attract and recruit very talented staff in the hospital, in primary and community care, and that only adds to the achievement going forward as we deliver our ambitious programme. In service terms, we have a CT scanner, we've established a service-led in high dependency, and we have very capable and qualified senior charge nurses who joined us from afar. In accident emergency and assessment rehab wards and departments, we've also recruited to senior charge nurse posts. And we've also secured infrastructure posts to help our clinicians do their job regardless of where they work. And finally, where are we with integration? The board and Orkney Islands Council have worked hard together to ensure we make the right decision for Orkney. We have said Orkney is different, and solutions agreed on the mainland often are not transferable to the island. And in reaching our decision to support a lead agency led by NHS Orkney, we will aspire to do the right thing for Orkney. I can assure colleagues in this room that we are still talking to our Orkney Islands Council in a partnership way that will actually strengthen our integration agenda going forward. And I'm optimistic and hopeful that we will reach a decision in the next 4 to 6 weeks on our integration model. And lastly, performance and financial balance. This board, I would suggest, Chair, has come a long way, and our staff have travelled with us on our transformational change agenda. And at times that journey has been hard. But I'd ask everyone just to think for a moment on what you in this room as staff have achieved. And I've not even mentioned the new hospital, the new healthcare facilities, but let's not forget how it felt to secure that outline business case approval. Many people thought that we could not achieve, and we did. This board does achieve, and in being ambitious, we can get it wrong, but we're not frightened to say sorry. We're not frightened to listen, and we are open for business to respond. In summing up, Chair, I think we had a very successful 2013-14, despite the need for additional brokerage. And we have reflected in our successes and our not-so-good moments in this boardroom, all of which add to our learning and our ongoing journey of learning and improvement. Chair, thank you for allowing me this time to share our successes.
Thanks very much indeed, Cathy. I think I've probably got the easier job this year. I think that usually I have to stand there and spout eloquently, but that was an excellent summary of the year gone past. What happened before in past annual reviews up until about 3 years ago was, and Yvonne and others will remember it well, as will most of the people who've been here a while, and that was that we actually went on and met all different groups, and then we went to 2 or 3 hours of digesting the whole year and finding out what was wrong right into the entrails of it all. That's not the case now, and I think it's much better now, because what we do now is hand it over to you, the public, the staff, to ask us the particular questions that need to be asked about the performance we've got. Sometimes we do bash ourselves about an awful lot on the negatives and kind of forget the positives. And there's a lot of good positive stuff coming in a year in which, as Cathy says, we've had new hospital, got the site ready for the new hospital, high dependency unit, CT scanner, and the consultant-led model for within the hospital. It's a huge undertaking, NHS Orkney, and I'm immensely proud to be part of it. And I'm immensely proud of the board, all members of the board, and staff who actually bring together what we have done over the year. Now it's your turn. And what is left for me to do is really to facilitate a questions and answers session. And a lot of the team are here already. Some of the non-execs might be asked questions as well. Stand ready. But any questions you've got, we'll try and answer. Please don't make them patient-specific. That's the big thing we do ask at the annual review, because obviously we can't go into, for patient confidentiality aspects of some of the questions. So try not make them patient-related. But any particular questions, this is your chance. Who's going to be first? This is where we keep quiet until somebody puts their hand up. No. It would be a sick. You're very quiet in the front row. Sandra?
As always.
This is Sandra.
Thanks. I was very interested, Kathy, in you used the word communication. And it's something as I go about the NHS Orkney, communication seems to be something that is still needing quite a lot of work and effort on the personal level between staff and patient, and on the computer level and things. And I wonder what is going to be planned for the future.
Good.
Thank you.
Over to you, Kathy.
Thanks very much. I think we can always improve the messages that we receive and respond to, and the messages that we put out. So we're always looking for new ways of doing that. And in fact, the board just last week actually had a discussion in regard to communication and how we connect, in particular, externally with the community and the people of Orkney. And if you've got suggestions, we would be delighted to hear. The things that we came up with was some kind of civic newsletter, but more importantly, we come up with much more face-to-face dialogue, because people have actually said, we actually get a lot of that, Kathy. Internally, our staff will tell us, we've got the blog, we've got emails, but they want to actually sit down and have a chat, just like we're having today. Maybe not as formal and maybe not as nerve-wracking, but certainly that face-to-face discussion. So I think we can always look to improve our communications. One of the heartening things, I suppose, for me in regard to the independent national staff survey was our staff said communications feel really good. In terms of improvement, they asked that there was more face-to-face communications, and in particularly more communications with them and their line managers. So we're really trying to think, how do we facilitate that? I think using groups like yours, that you chair, Sandra, is very, very important in terms of how we connect with the community. And if we can think how we can do that, particularly around integration, for example, that's a big agenda item going forward for the council and indeed ourselves. I think that would be a topic that I think people would respond to.
Thanks. I should say earlier today I met with the Area Partnership Forum and the Area Clinical Forum, and one of the things the Cabinet Secretary is always very keen to push is really clinical engagement, making sure that the clinicians and staff are very much at the heart of all we do. That I was very heartened. I think it was a very positive meeting that we had earlier on. It gives me the golden opportunity to actually ask staff the questions in regard to particularly communication, but you can see what we've got. Kathy mentioned earlier on, second best territorial board as far as the staff survey was going, so people were responding. Sometimes, and it was found in one of the surveys that we did, but we try too hard on communication. It's just making sure that the avenues are open for everyone to get to us. And this is kind of an avenue today for you to get to us and find out what we're doing. You've caught us there, as Andrew perfectly, at a time when the communication strategy is being relooked at by the board. So any ideas that the public have of how we can improve that can be injected into that strategy. So please come up with your ideas and suggestions. We've done quite a few other things. Apart from what Kathy's already mentioned, social media has become more of an issue now, and we've got now so that staff can actually liaise, not during work times, but in specific areas where they can link up. And also we've got the Facebook and Twitter accounts, which Emma's here today tweeting and doing all our stuff in the corner there, to make sure we try and get the outside world interested in things that we do. So we do try, but yes, we can always do better. Does that help? Yeah.
Yeah. Is the link between the board? Is the link between the board or the hospital and the practices going to improve there? Because I know, and I've had quite a lot of comments in recent times about people having attended the Balfour for an appointment, and when they've gone to their GP within a bit, 4 or 5 weeks, they still haven't had a report back. And it's happening just from both the Balfour and from when they've been down south. And I wonder if there's anything being looked at to try and speed up that form of communication as well.
Cathy.
Thanks very much for doing that follow-up, Sandra, because you did kind of allude to that in your first question and I forgot to respond, so thank you. We're obviously going to be investing in IT, our information technology, patient administration system. So in November of this year, our track care will actually go live on this site, so we can actually track care as we go. I also pick up that people wait too long for feedback in relation to inpatient stays where there's a communication letter, or indeed we are waiting on results from NHS Grampian. The IT solutions that we've got should address that, and I think that we just need to do a bit more of talking with our colleagues to actually improve that, because our solutions are actually there. And I'm looking to Martinez and Louise in particular, our clinical directors, to actually add to my answer, because I actually think it's about a culture. It's about actually getting access to staff to actually deliver on letters and so on. We have invested and we continue to invest in a very efficient administration pool, because that's really critical to getting those letters typed and sent out. So in year we've had some vacancies and so on, I'm not going to pretend, but that is something that we really keep a very close eye on.
I think Martinez is the medical director, wishes to come in as well.
We've recently implemented a system called ECI letters. Now ECI stands for electronic communication and something else, can't remember. But what it actually does is it's an electronic system where the letters are typed into, and then the toing and froing of the letter back from the typist to the consultant and out to the practice are all happening electronically. So it takes out some of the time that these letters are delayed. Some of us are also using voice recognition typing. And if you use all of this, it's actually possible to get the letter out to the practice either the same day or the next day. So it is technically possible. It doesn't happen all the time, and some people are a bit slower in taking up all these electronic means of doing business, but hopefully this will impact, and getting that absolutely crucial information from the hospital back to the GP practices, get that expedited.
So we're looking at new options. I think I have to say, when voice recognition came in and Martinez started using it, and I and he were usually last to leave the office, I kind of worried about him because I thought he was talking to himself. But technically he does a lot of that work later on in the evening to get tidied up. iPads as well. We're hoping to bring in more iPads, and we've got in regard to the patient journey. You maybe want to say something about what we're trying to achieve in regard to the patient-centred aspect and learning from the patients through IT.
If I may, Chair, I was going to invite the Director of Nursing, Elaine Peace, because Elaine's actually been leading this initiative, and I really don't want to steal Elaine's thunder because it's been quite exciting work.
Over to you, Elaine.
Okay, thank you, Cathy. Thank you, Chair. With regard to the introduction of iPads, people may be aware of the website Patient Opinion, and we're really working hard to try and promote the use of patient opinion across all our clinical services. We've been successful in getting some money from the patient opinion team, and we have bought iPads, which we have recruited a team of young volunteers from the high school. 10 young people are going to be coming in. They've been trained in the use of they've trained us actually in the use of iPads, but they've had some induction sessions in working with older people, working in a hospital environment, and they will be going into the wards to use a preset questionnaire which is being uploaded onto the iPads, and they'll also be encouraging the use of patient opinion. So this will be real-time feedback from patients on the ward, and we're doing similar work in the community as well. So it's a really exciting opportunity here, and certainly the young people themselves are really looking forward to getting involved with this.
good. It's getting the volunteers into the hospital as well and into the community as well. I should really highlight here, obviously, still very proud of the fact that NHS Orkney was the first public body in Scotland to go paper light, and the savings come through every year on that. I know we got criticised early on about iPads for everybody, but actually the savings are quite amazing. So I think most boards and most councils now are moving in that direction. Is that okay? Did we answer your questions all right, Dan?
Thank you.
And public partnership forums, obviously, Zandra is the chair of the Public Partnership Forum. Obviously, we'll be looking to see how that progresses this year. We're hoping to get some guidance on that as soon as the integration bill gets through its process. Any other questions? Yes, sir.
I'm Stuart Walker. I would like to congratulate Ms Cowan for presenting a report remarkably free from health service jargon. Thank you. I have 3 points, if I can keep them in my skull long enough.
Go ahead, Doctor.
I noticed that you didn't make any mention of adult obesity. Now, apparently we're facing an epidemic of diabetes, and that will lead to big demands on the hospital beds, big demands on the community services. And I agree, childhood obesity is important, but I think adult obesity definitely is going to land us all in trouble. That was one point. The next point was, I'm wondering, what sort of plan have you got for dealing with what you hope will never happen? 30 badly injured people appearing on your doorstep in the course of half an hour or so. It's never happened yet, but with so many coaches on the road, they're getting bigger. The roads are not getting bigger, and we could end up with a very serious situation. And the last one, I've yet to be convinced that this care in the community is working. My image of care in the community is stressed out, usually ladies, flying about the countryside in their cars, desperate to get to the next person. Fly in, do what they have to do, and fly out again. And they're underpaid. And people don't think that's good enough. So I managed to keep the 3 points in my brain for long enough. Thank you.
Thanks very much indeed. Very good points. Kathy, you go first. Yeah? I think there's some of the team might want to come in on one or two of those as well.
Yeah, I maybe ask Dr Wilson to respond to the adult obesity and the diabetes, but maybe start with your last point first, if I can, Mr Walker. And I suppose in responding, well, I'll start with the emergency and get it out the road. I suppose in terms of an emergency here in Orkney, it's very, very important that we have what we call robust emergency plans in place. Emergency plans that actually are not just about us as an NHS, but with our partners. I can assure you that we do have robust emergency plans in place. We also undertake tabletop exercises, you know, things like what if, Flotta blew up and so on. And your incident about the coach actually nearly happened a couple of weeks ago. We actually had a coach that came off the road, and thankfully we were able to respond as a team, quickly assess the people on the coach and discharge those patients at the scene. So we didn't actually have to bring people into hospital. We are very, very clear that in terms of the size of the Balfour, we would immediately look for support elsewhere, and that's where our neighbouring boards and indeed the Scottish Government would kick in, because we would not be able to respond sufficiently to that amount of emergency admissions hitting our door. And I think to say that and be brave and say that is the right response, because it's when people think they can do things and people think they've got resources and expertise in small settings that you get yourself into bother. I say that as a previous accident emergency nurse, where it is absolutely important to triage and move people to appropriate services. So we have got a robust plan. Would it be scary if that happened? Of course. But we do have very, very skilled anaesthetists, and it's those anaesthetists supported by our surgeons and physicians and so on, and indeed our primary care and community nurses and doctors that actually help support to deliver life-saving treatment so that people can be airlifted off island as quickly as possible. So we are very good at triaging in regard to that. Did you want to come back?
Yes.
Yes.
The performance of the Scottish Ambulance Service does not seem to be terribly good, and they can't respond to one emergency. How are you going to mobilise the RAF, or what sort of procedures would you have to do?
And we do that, and I just cast people's mind back to the ash cloud, for example. You know, when people were saying, how are we going to get people airlifted off Orkney, you know, in a situation where we do have an emergency. And that's the time when we actually look to the Military of Defence. So we've got a very clear escalation policy that would actually trigger and kick in. And sometimes, you know, we didn't have to do that in the ash cloud, but my colleagues in NHS Shetland did. I think you're right to flag up the Scottish Ambulance issues on island. It would be absolutely dishonest of me not to respond to that, because we've talked about that at board level, we've talked about that in the community. What I can say is we've been working very hard and very closely with our ambulance colleagues, and they have begun a process of recruitment, not just to additional staff but to additional vehicles here in the mainland and indeed on our islands. So things are getting better. To help our colleagues in Scottish Ambulance, we have made it clear that should they need to escalate if they were not able to respond, that we have a very clear protocol where we would be able to discharge, send out nurses and doctors to help in that situation using our primary care and or indeed our hospital services. So our plan is very, very articulated. One of the things that I've learned since joining NHS Orkney from Glasgow is we have business continuity issues just about every day. You know, our theatre flooding, so we're actually very good at this bit. I shouldn't tempt fate, should I? I can see my colleagues at the front going, Cathy, don't go there. But we do have very good plans, and we do have very good working relationships with ambulance, but also with our neighbouring boards. Your third point, I think, was in relation to home care services. Yes. And I think people have heard me say in this boardroom that our home care services could be better. And again, in working with our colleagues in Orkney Islands Council who deliver home care services, we are very, very keen to develop a kind of staffing complement where people have permanent posts, and I think our council colleagues have acknowledged that, so that we attract the very, very best. And also, this board actually commissioned a home care review, I think probably, Chair, about 18 months ago maybe, where we actually wanted to see how the care was being delivered so that people weren't flying in and flying out, because there's nothing nicer to have a chat, there's nothing nicer to do that social exchange, because in doing so, you might just pick up things that aren't just quite right. And we don't want to see people then coming into hospital. We want to support people in their own home. So in home care, I can give you a commitment to continue to work with our colleagues in Orkney Islands Council to strengthen that partnership, so that we've got home care workers working with our community nurses and the likes to actually provide the very, very best. Not just to people who are living at home, but to their carers, because carers often can be equally stressed out. So it's that kind of two-pronged approach. So our review actually highlighted a number of issues about people going from, Bursey to Kirkwall, and we were saying, could we not actually manage this in such a way that people living in Bursey actually see people in Bursey, so that they're spending more time with the client as opposed to in their car? So quite a number of issues underway to try and address that. And I'm going to, Louise has been writing in relation to the adult diabetic and obesity issue. So, Dr. Wilson, if I may, Chair.
Director of Public Health.
Hello, you're absolutely right in terms of highlighting the important issue that adult obesity and that challenge. And we know what causes adult obesity. It's not going to be a disease that we don't understand. It's the imbalance of calories in and activity taken. And as such, the health service carries a huge burden from the result of the diseases that come from obesity. But where we're looking to make the solutions is actually through the community partnership, because actually a lot of the solutions lie out with of the direct ability for the health service to address. So it's about making it easier to be active, and that's also partly a council responsibility too. And so it's within that healthy working and healthy weight groups, having Active Orkney, challenging also that being active isn't necessarily about great sporting achievement. It's about how we can all be active, and particularly I'm interested in how can those with chronic disease actually be enabled to be more active. We also have, through public health, the Keep Well programme, which again is addressing and looking at obesity as part of the strand of that one-on-one intervention that it takes with people to discuss with them, how can we help you be more active. But sadly, we actually live in what's called an obesogenic environment. It's an environment that promotes obesity. So when you go into the supermarket, it's about cheap food that often doesn't have good nutrition to it. Poor food labelling, so that even if you do want to choose healthy food, it's not always easy to do that. And those are issues that often actually have to be taken up at a governmental level to ensure that the food's appropriately labelled, that we make it easy for people and tackle that. I always, every time I go into a WH Smith's and I'm pushed about, would you like to buy that extra chocolate when you're on the mainland, I actually say, where's your fruit? Where are your stands? How are you helping people eat a healthy diet? So I think those are the key points I wanted to make.
On that last one, health promoting health service is a big thing now, Stuart. And we are looking, aroma cafes have set up in quite a few health boards now have aroma cafes. Aberdeen's either got one open or just about to get one open. And some of the profits from that go into NHS, but also they promote better food. So getting away from the WH Smith's, which is in certain hospitals, with the big chocolate bars at the front, and getting into that healthy food. Apparently you can have healthy muffins nowadays as well, and Aroma sells them. That sounds like a real advert. But the more of that we can get in, and the health promoting health services now come up a level over the last year. And people are being more aware of it. I think I mentioned to meeting the partnerships this morning, and they were very aware of it. And obviously everything you do in health, you have to be aware of. You kind of can help those that you are talking to and encourage them to be a bit more healthy. It doesn't get over the problem, because you'll always have people who love their chocolate and love their thing, but it's a real dilemma that we're facing, and you're absolutely right to raise it. It's one of the biggest things facing health boards in Scotland, along with, I would think, alcohol and alcohol-related issues. So thanks for raising that, and the others. And the one other point, I think, too, I would say that we've got a greater improvement in our liaison, I would say, over the last year with the Scottish Ambulance Service. And the point you raised with in regard to the cost element of social services, that's something that certainly has been raised. I'm on a health. I'm in a ministerial task group that deals with integration. And one of the big issues that the Cabinet Secretary has raised there is the difference in the funding mechanisms for health and for social services. So if the two are to come together, then there's going to be having to be some balance put in there to ensure that the social services side is funded better. Now, any more? Are you happy with the response there? When you're going away happy, you see. Any other questions? Anyone else want to? I mean, anyone can ask a question. Really. How's South Romsey? No. Dave, do you want to ask a question? Are you happy to wait?
I don't think it would be appropriate for me to ask a question.
Okay, that's fine. That's good. Okay, okay. You can hold me to account. Anyone at all? Are we all done? It's always a good sign when there aren't so many questions. In some respects, you think you're doing well, but that's maybe a false sense of security in some respects. Last year we had questions that, to the extent that we were really having to stop. And it may be that, having a minister or a cabinet secretary come along, you'll get more people coming along to ask specific questions. But thank you for those questions that you have asked. And I hope that we've satisfied you, and certainly we know that one person's going away happy. As far as everyone else is concerned, this will be the close of our annual review, a lot shorter than normal, but we've carried out the duty that we must do, and I'm delighted to see, and thank you very much indeed for all of you coming along. I wish you well in the year ahead. We'll certainly be taking on board the public view in the year ahead. I know we had some interesting times with the site for the hospital, but we got that one all resolved, and we're now moving forward with some other really quite big issues to tackle, and we want the public and staff to be fully involved in all of that. Just before I leave, Cathy, is there anything you'd like to say as a close?
Just to put in record, Chair, a thanks to all the staff in NHS Orkney and indeed the people in Orkney who have contributed to the successful programme that we have underway. It's a pleasure, the role that I conduct in Orkney, because people really actively engage, and that's a really good thing.
That's great, Cathy. And all that remains for me to do is to thank Andy for the technology, and Jean, who has the enormous task of trying to bring the annual review together every year. Thank you very much indeed, Jean, to the board secretary. I think we should all give ourselves a round of applause. I call the annual review to close. I close the annual review.